Have you ever wondered why teen pregnancies and STD rates are still high, despite living in an age of information? It's a puzzling paradox, isn't it? Here we are, in an era where knowledge is at our fingertips, yet we're witnessing a concerning trend in teen sexual health. It's a disconcerting reality that calls for our attention and understanding. So let's delve into this issue, peel back the layers, and ask the question that's on many minds. Could it be that our teens are not getting the right kind of sexual education they need? Let's examine some startling facts about teen sexual health. While it's a topic often brushed under the rug, the reality is that many teenagers are sexually active. Unfortunately, without adequate education and resources, this activity can lead to serious consequences. For instance, the United States has one of the highest rates of teen pregnancies among developed countries. Each year, nearly 200,000 girls aged between 15 and 19 become pregnant. This isn't just a number. These are young lives dealing with the physical, emotional, and financial burdens of an unplanned pregnancy. And it's not just pregnancies we need to worry about. Sexually transmitted diseases, or STDs, are a significant concern among teenagers. In fact, young people aged 15 to 24 account for half of all new STD cases each year. That's a staggering figure, especially when you consider that most of these infections could be prevented with proper education and access to protection. But the impact doesn't stop at the individual level. These issues have far-reaching societal effects. Teen pregnancies and STDs burden our healthcare system, affect educational outcomes, and perpetuate cycles of poverty and disadvantage. Moreover, the psychological impact on teenagers cannot be overlooked. Dealing with an unplanned pregnancy or an STD can lead to stress, anxiety, and depression. It can also affect their self-esteem and future relationships. In many cases, these are not isolated incidents but symptoms of a larger problem. They reflect a lack of understanding about sexual health, a lack of access to contraceptives, and a lack of comprehensive sex education. These facts and figures might seem overwhelming, but it's important to remember that they represent real teenagers facing real challenges. Each statistic is a story of a young person who didn't have the information or resources they needed to make safe, informed decisions about their sexual health. These numbers paint a grim picture, but where does the problem truly lie? Health experts believe that proper sex education is crucial in addressing these issues. Indeed, many health professionals have expressed that comprehensive and accurate sex education plays a pivotal role in promoting teen sexual health. Dr. Laura Berman, a renowned sex educator, points out that sex education is not just about teaching teens how to avoid pregnancy or sexually transmitted infections. It's about teaching them to respect their bodies, understand their feelings, and make informed decisions. Similarly, the American Academy of Pediatrics has stated that sex education that includes information about contraception can help reduce teen pregnancy rates and the spread of sexually transmitted infections. This perspective is also shared by the World Health Organization, which emphasizes that sex education can contribute to the development of life skills and foster responsible behavior in young people. In a study published in the Journal of Adolescent Health, researchers found that teens who received comprehensive sex education were significantly less likely to report teen pregnancy than those who received abstinence-only or no sex education. The study concludes that comprehensive sex education is effective in reducing teen pregnancy rates. Such insights underscore the importance of sex education in teen sexual health. Dr. Deborah Tolman, a professor at the City University of New York, emphasizes that providing teens with comprehensive sex education allows them to navigate their sexual lives with confidence, knowledge, and safety. The Guttmacher Institute, a leading research and policy organization committed to advancing sexual and reproductive health, asserts that comprehensive sex education can empower young people to make informed decisions about their sexual health and relationships. In essence, proper sex education goes beyond the mere provision of information. It fosters a deep understanding of the physical, emotional, and social aspects of sexuality. It equips teens with the knowledge and skills they need to lead healthy, fulfilling sexual lives. Clearly, there's a consensus among experts. Sex education matters. But what does proper sex education look like? According to educators, our current sex education system is falling short. Even though we've made strides in acknowledging the importance of sex education, there are still numerous issues that need to be addressed. For starters, the information provided is often incomplete. Many programs focus solely on abstinence, ignoring the realities of teen sexual behavior. This lack of comprehensive information leaves young people without the necessary tools to make informed decisions about their bodies and their health. Another issue is the stigmatization that surrounds sex education. It's often treated as a taboo topic, something to be whispered about in hushed tones. This creates a culture of shame and secrecy that can lead to misinformation and misunderstanding. When we treat sex education as something to be embarrassed or ashamed of, we're doing a disservice to our youth. In addition to this, the curriculum often lacks inclusivity. Many programs are heteronormative, excluding LGBTQ+ students from the conversation. This not only marginalizes these students, but it also deprives them of crucial information about their sexual health. The problem is also systemic. In many places, there is no mandate for sex education to be taught in schools, leaving it up to individual districts or even individual teachers to decide what to cover. This leads to a patchwork of education, with some students receiving comprehensive, accurate information, while others are left in the dark. Furthermore, many sex education programs don't address the emotional aspects of sexuality. They focus on the mechanics of sex, but neglect to discuss topics like consent, healthy relationships, and emotional well-being. This leaves teens ill-equipped to navigate the complexities of romantic and sexual relationships. So, if our current system isn't working, what can we do to fix it? It's time for a change. It's time for a sex education system that is comprehensive, inclusive, and destigmatized. A system that empowers our youth with the knowledge they need to make informed decisions about their bodies and their relationships. Because when it comes to sex education, our teens deserve nothing less. Experts suggest a shift towards comprehensive sex education. But what exactly does that mean? Comprehensive sex education is a broad, inclusive, and fact-based approach that goes beyond the traditional methods. It doesn't just talk about the mechanics of sex and the risks of unprotected intercourse, but it also covers the emotional and social aspects that are often left unaddressed. Picture this. Instead of a teacher awkwardly navigating through a slideshow filled with diagrams and medical jargon, imagine a class where students are encouraged to ask questions, share their thoughts, and engage in open discussions. Comprehensive sex education fosters a safe and respectful environment where students can learn about sexual health, relationships, consent, and even about different sexual orientations and gender identities. It's education that acknowledges the diversity of human experiences and promotes understanding, respect, and acceptance. And why is this important? Well, studies show that this approach can bring about significant benefits. For one, students who receive comprehensive sex education are more likely to delay sexual activity. They also have fewer sexual partners and are less likely to engage in high-risk behaviors. And when they do become sexually active, they're more likely to use contraceptives and to get tested for sexually transmitted infections. But it doesn't stop there. Comprehensive sex education also contributes to healthier relationships. It teaches young people about mutual respect, communication, and consent, equipping them with the skills they need to navigate their relationships in a mature and responsible manner. In the words of experts, comprehensive sex education can be a game changer. It's not just about preventing unwanted pregnancies or sexually transmitted infections. It's about preparing young people for life, for their relationships, and for their future. It's about empowering them with knowledge and skills so they can make informed decisions about their bodies and their lives. But how do we ensure that teens have access to this kind of education? That's the challenge we face, and that's what we'll explore in our next scene. The solution starts with you and me. Let's consider this: a world where every teen has access to comprehensive sex education. A world where they're empowered with the knowledge to make informed decisions about their health and well-being. It might seem like a lofty dream, but it's achievable. And the first step towards it is for each of us to become advocates for proper sex education. So, how can we make a difference? It starts with education. Seek out accurate and reliable resources about sexual health. Share this knowledge with the teens in your life. Let them know it's okay to ask questions, to be curious, and to want to understand their bodies. But we can't stop there. We need to bring this conversation to our local school boards. Advocate for comprehensive sex education programs in our schools. It's about more than just teaching teens about contraception or how to prevent STDs. It's about teaching them about healthy relationships, consent, and respecting the boundaries of others. And finally, be a role model. Show the teens in your life that it's okay to talk about these topics, that their questions are valid and their concerns are taken seriously. Remember, it's not just about preventing pregnancies and STDs. It's about ensuring our teens have the knowledge they need to lead healthy, fulfilling lives.